Hey everyone, my name is Josh and I study blood flow restriction training. And the goal of these videos is to make blood flow restriction training easy for you so you can better understand it and you can better apply it in practice. Now in this video, I want to go over why blood flow restriction can be a really useful tool before and after total knee replacement. Now, total knee replacements are one of the most common orthopedic surgeries in the world, right? And often before knee replacements, patients have already experienced significant muscle losses in their leg, right? Because just from years of knee pain, it has led the patient to have reduced activity and just an inability to perform leg exercise, which has resulted in just losses in leg muscle size and strength. Now, importantly, leg strength before the surgery matters because the stronger your leg muscles are before the surgery is going to lead to better recovery after the surgery and just a greater success of the surgery. So that's why surgeons often tell patients, well, before they do the surgery, they need to strengthen their leg muscles. They need to get to a certain amount of leg strength before they'll do the surgery. Now, this creates somewhat of a problem, though, because in order to strengthen your leg muscles, a person needs to lift, heavy enough weights. You need to do heavier weighted exercises in order to create a meaningful stimulus and create a meaningful adaptation in the muscle. But these patients that are about to have a knee replacement have a hard time doing this just because it's really painful in the knee to do this. Okay, this is where blood flow restriction can come in and be really important and be really useful. Because remember what blood flow restriction allows a patient to do. It allows a patient or a person to lift very light loads. And when you combine light loads with blood flow restriction, it creates a meaningful stimulus and a meaningful adaptation in the muscle. Okay, so blood flow restriction can be really useful here before the surgery as a prehab strategy where patients need to strengthen their leg muscles, but they just can't tolerate the heavy weighted exercise that's required. Well, they can opt for light loads combined with blood flow restriction in order to create a meaningful stimulus and just improve their leg strength. But what does the research say about this? Well, the strongest research that supports this actually comes from patients with knee osteoarthritis, because patients with knee osteoarthritis kind of have the same problem, right? They have a lot of knee pain. They can't really tolerate heavy weighted exercises. Well, several studies have shown that in these patients with knee osteoarthritis, if you combine blood flow restriction with light weights, that can really improve these patients' muscle size and muscle strength. Okay, so these findings have led researchers to really be interested into applying blood flow restriction as a prehab strategy for patients about to have a knee replacement. Okay, so there has been a few kind of small studies that have investigated this specifically, the effectiveness of blood flow restriction before a total knee replacement. But findings are still inconclusive. They're still limited. Okay, but there is some kind of preliminary evidence to suggest that, blood flow restriction can be useful for patients before the knee replacement in order to improve muscle size and muscle strength. So that's before the surgery. But blood flow restriction can be really useful after the surgery too, right? After the surgery, patients need to continue those leg exercises. But it's difficult, right? It's, again, difficult to perform leg exercise at a heavier weight. Because in the knee, you just after the surgery, there's a lot of inflammation, there's a lot of swelling, and patients can't really tolerate these heavier weighted exercises. Well, what can they do? Well, they can opt for light weights, which is much more tolerable, much more doable for them, combined with blood flow restriction in order to enhance that stimulus and create a meaningful adaptation in the muscle in order to maintain that muscle strength and muscle size in order for them to recover from that surgery. Okay, so blood flow restriction can be a really useful tool before and after a total knee replacement. Before, when the patients need to strengthen their leg muscles, but just can't tolerate the heavier weight exercise that is required to do so. Well, instead, they can lift light weights combined with blood flow restriction in order to do so. And then after, when they need to maintain muscle strength. But again, the swelling and the discomfort following the surgery prevents them from lifting heavier weights. Well, again, they can opt for light weights combined with blood flow restriction in order to maintain their muscle size and strength. Okay, so in my next video, along with Jenny, we're going to take you through some blood flow restriction exercises that you can do as a prehab strategy before a total knee replacement. Okay?